regards to the Disaster Management Act, what can we expect in terms of whether the president will address the nation tonight? We know that that's not necessary in order to extend the lockdown regulations in terms of the Disaster Management Act. But let's bring in now COGTA Spokesperson Lungi Mtshali for more on the story. Lungi, very good morning to you.
Good morning to you too, and thank you for having me.
All right, so I guess big questions, pressing questions. What is the situation currently? Is cabinet meeting? What are you hearing?
Yes, as you know that the national state of disaster expires after another month of extension. It expires tonight at midnight. So we will be proposing to cabinet this afternoon for the extension of the national state of disaster. And then we will be tabling the reasons why we feel that the state of disaster should or should not be extended.
So as far as you know,
after that, cabinet will then make an announcement, hopefully today still, and then the proper gazetting either way needs to be made.
So we can assume that the state of disaster will be extended, correct?
Yes, based on, I can say that that's what we will be proposing, but cabinet still needs to process it. Because if you remember on the 25th of April, we outlined how we're going to exit from the lockdown.
Yeah.
And it involved 5 stages of the lockdown, which was level 5 up to 1. And those levels will be informed by 2 things. One would be what we see in terms of the number of infections vis-a-vis the state of readiness of the national healthcare system, whether the healthcare system is able to deal with those number of infections. So it would be that balance that informs where we go with the state of national disaster.
So the state of national disaster, which is declared, is based on the Disaster Management Act. I want our viewers to understand this process. What happens today, for example? So COGTA will propose that the state of the national disaster is extended. You sit in a meeting, a cabinet meeting. Where does the call come from in terms of the movement from a level, for instance, level 3 to level 2? Take us behind the scenes in terms of understanding that process.
Okay, so as a coordinating department, that is one of the proposals that we do make coming out of the MCCC meeting. We do make that proposal to MCCC, but that's informed by deliberations and consultations with other departments. For example, the Department of Health will tell us what their state of the healthcare system is, but also we already know what the number of infections are per province. And based on that, we would say then the regulations that we have to promulgate need to support us moving out of a dangerous situation when it comes to the state of the healthcare system. So when we move either way to the relevant level within the risk-adjusted strategy, it's one of the recommendations that we do make to the cabinet, and cabinet approves them or makes or suggests tweaks or changes to that recommendation, and then there is an announcement that follows that.
So having considered all of these variables and considering the trajectory that South Africa is heading to in terms of its COVID-19 infection rate, you reckon we're going to move down to level 2?
I can't predict what cabinet will decide. Like I said, they will take on our recommendation in whatever form it is, and they will apply their minds as well, and then we will have a final product in terms of where we move. So I just wanted to say that when we move within the levels, whether we are cancelling level 3 or we're moving to level 4 or moving to level 2, that is still within, we must be still within the national state of disaster. So the extension the extension and the movement of the level are not mutually exclusive.
Sure. I'm not sure if you can see what's on our screen currently. We had some breaking news this morning. The Supreme Court of Appeal in Bloemfontein granting the Fair Trade Independent Tobacco Association leave to appeal the ban of selling tobacco products. What's your response?
Our response to that is we understand the motivation for the tobacco industry because they want to trade. And of course, they're not the only industry that's not trading due to the regulations in place. All of the other industries are also either engaging government or they are taking a more drastic action like the fair trade are doing. But for us, we are confident that what we are doing is in the interest of the general public, to ensure that each and every South African that does contract the virus has a fair chance of surviving it. So we need to make sure that we are protecting the healthcare system at all times.
Mm-hmm. Just with regards to the deadline to extend the national state of disaster, you have literally until, midnight tonight? Is that correct? To do that?
Yes, you do have until midnight to extend it. Yes.
So let's just take worst case scenario. What happens if you don't extend it? What happens tomorrow?
What would happen then? It would mean that the regulations that are in place cease to be in effect. Yeah. But then there are other laws that can kick in terms of protecting the healthcare system. There are acts that may not be as responsive or as agile in terms of dealing with the pandemic the way that it is. But
what are these laws, Lungi? What are these laws that can be used in that regard?
There are acts. There are acts that would protect the country in terms of community. So it's a Communicable Diseases Act that will be able to kick into place. That will have some limited, functionality in terms of dealing with a disaster or a pandemic of this nature.
But you're saying in all likelihood it will be extended by midnight tonight?
In all likelihood, Cabinet will probably, yes. Yes. I don't want to preempt it, but I'm confident that Cabinet will make the right or make the necessary recommendations.
All right, we appreciate your time. Thank you very much indeed, Lungi.
You're welcome.
All right, COGTA Spokesperson Lungi Mtshali there. All right, we are keeping a close